Hi everyone, welcome to my channel. My name is Candace and this is Healthy Living with Candace. Today I have with me
Dr. Deanna Luhani.
I'm Dr. Spendy.
I'm Dr. Deanna Luhani.
And I'm Dr. Spendy, and we are with Reconnect Chiropractic. We are your family chiropractor here in Loveland. We're a family wellness office that also specializes in prenatal and pediatric care. That means we take care of the whole family. Between the both of us, we've got enough training and certifications to be able to take care of all of you. Our main thing is that our focus is overall nervous system health, balance, and essentially overall function of the body, not just your aches and pains. So, with that being said, Dr. D, who's a good candidate for our office?
Anyone who has a spine. Like he said, any age or stage, if you have a spine, you can get adjusted.
If you have a nervous system, you need to get checked. You go to the dentist regularly, you go get your eyes checked regularly, you go to your primary care for overall health. Your nervous system is probably the most important thing that you should be getting checked. Reason being, my handy dandy spine, is because what sits up here, Dr. D?
So you have your brain up here. This is in your head. And then you have your spine, which houses your nervous system. So all the nerves that come out of the spinal cord, they go into the vital muscles and organs so your body can function properly.
Literally everything is controlled by your nervous system. So when we're looking at your spine and we're adjusting, what we need to do is to make sure these nerves that come out of here are nice and free and they can communicate between the organ and the brain so that you can function the way you're supposed to and not have diseases, aches, pains, all the different things that you can get. So what are some most common cases that would come through our office?
This is the fun question. So we see a lot of things. A lot of people think that chiropractic is just about pain, but really it's about so much more. And that's why we see all ages and stages. So some of the common things we see are headaches, neck pain, low back pain, a lot of sciatic pain. But some of the more interesting cases and the more maybe abstract cases that we see are bedwetting, maybe delayed milestones, even some digestive issues.
Yeah, especially for our kiddos. We see lots of colic, lots of digestion. She said delayed milestones, so maybe your kid's not crawling at the age they're supposed to. Maybe they skip crawling. That's a very important thing to actually have, is that we need them to crawl at certain ages because it helps with brain development. So all things that you might not think chiropractic is really taken care of, it's something that we do based off all the extra training that we've had. We're both trained through the ICPA, which is the International Chiropractic Pediatric Association. So that's what gives us a little bit of an edge on at least adding the kiddo care to our office as well. We do take care of all adults, all that kind of stuff we learned through school and traditional things, but then we've added all the extra training to be able to take care of the whole family.
Because chiropractic is definitely not a one and done or a one size fits all session. And so what we do in our office is we have care plans, and that's going to be individualized for the person. We strongly believe that every body is different, and so they don't need the same care like everybody else. And so our kid care plans, our adult care plans, they're all going to look slightly different. And so based on what's going on, once we do a thorough exam on that first visit, we're really going to see what needs to happen, how we need to adjust you, and what your care plan would look like.
Yeah. So if let's say you're an adult, you've got some things you're wondering about if you should get care. When you come in, we're going to do an exam. We're going to do full spine x-rays if we're able to. We do that in-house. It takes just a few minutes. It's not a very long time. That way it lets us be very specific with what we're doing. It gives us a good roadmap of your spine, where it's been, what's going on underneath. We don't want to guess with what's happening. I love to use the dentist because it's the same example as you go to the dentist. You don't want them just digging into your teeth to figure out where your things are. An x-ray gives them a good map, and they're like, hey, you've got this, 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 or you've got this developing. Let's take care of it early before it gets out of hand.
And something that a lot of people don't realize too is x-rays can give us an idea of what not to adjust. As chiropractors, we want to be as specific as possible. We don't want to adjust everything in your body. And so we want to make sure that we are avoiding the areas that maybe don't need to be adjusted as well.
That is correct, which is where customized care plans and how many visits you need to come in all vary based off what your goals are and what you got going on.
We do.
Oh, yeah.
We are a cash-based practice, and so we try to be as flexible as possible as we can in our office. And so we do have deals. We do have optional memberships for those who, even if you're an individual or if you're a family member, we do cater our memberships to you as well.
Yeah.
And so outside of that active care plan, we also have some maintenance options for you.
Usually, first and second visit are going to be the longer, 20 to 30 minutes, not a very long time. We try to be very efficient and respectful with your time. So when you come in, you're not going to be waiting around and doing a lot of things. We get you in right away, do our exam, get our x-rays, study those in detail, come up with a customized plan based off what we found and everything. And then moving forward after that, we do allow walk-ins for regular adjustments and things like that. And again, we try to be as efficient between both of us. You're never really waiting in the weight room or anything. We try to respect your time and get you in and out as fast as we can.
And something that also sets us apart is after we take your x-rays, we're going to go through those with you image by image and make sure that you understand what's going on with your care. So we want to make sure that you are your own advocate when it comes to health. So one thing that's really nice with us is that we are a husband and wife team. So we do have male and female in the office. Some people do have preferences. And so that's really great that we have both of us in here. We also are both Webster certified. And so this is a technique that allows us to adjust a pregnant patient. And the fact that both of us are adjusted, it allows more options for those patients to come in and get adjusted.
And the main thing, everybody's got certifications, everybody's got training, everybody's got all the things. The one thing that we've taken a different approach of that we take pride in is that we try to treat everybody that's coming in like family. I'm going to adjust your kids like I adjust my own kiddo, whether, whatever I adjust with him, however I take care of him, that's exactly how we take care of our kiddos. I'm going to adjust adults the same way as I would adjust her. We get adjusted weekly, and it's for maintenance. It's not for pain. It's not for anything else. It's to keep us healthy. So we just try to take care of everybody that's coming in the same way that we exactly would take care of our family. We're going to be honest with you. We're going to tell you what you need, whether you'd like to hear it or not. But we're not going to force you to do anything that you don't want to, because again, your health is your responsibility. So.
Yes. And one thing more to add is that we do have multiple different techniques that we use in office. And so between him and I, we use around 4 different techniques based on the body that is in front of us.
We've adjusted from a 2-hour-old baby. Yes, that is right. Come in and ask. And then all the way up to a 102-year-old, I think, is our oldest patient. So we are qualified to take care of you in any stage of life.
Yes.
So
now, while we have this platform, let's do a Mythbuster. Dr. Schmindy, when people come in and are scared about chiropractic, scared about getting their neck adjusted.
That is a common thing we encounter quite a bit. It's a reasonable thing. You should have trust with your healthcare provider. We're dealing with very sensitive things. So what I like to tell everybody is there's good and there's bad in every profession. If you go to somebody that is going to skip the exam, doesn't have proper training, yes, you might get hurt, whether that's a chiropractor, PT, personal trainer, medical doctor, whoever you go to. If they don't have proper training and they don't do a good job, you're not going to get a good treatment. So with that said, it is very safe. Like I said, we take care of our own baby. We adjust him regularly once or twice a week for overall health. We try to be very specific, very thorough, very gentle with what we're doing. Social media tends to be a lot of crazy stuff, because if I do a very specific, gentle adjustment, it's not going to get thousands and millions of views as somebody who's doing crazy nonsense on TikTok. So know the difference between the two, okay? Just because somebody is an influencer and has millions of followers and they're doing crazy stuff, that is not what true chiropractic really is. So we like to make a distinction there.
And like you said, your comfort is primary. And so when you come in, make sure that you voice those, make sure you let us know where you stand, and we will walk you through the whole process, making sure that you feel safe and comforted.
Thank you so much for sticking all the way through.
Thank
for
you.
Those of us that are still here, we would love to offer you a special, all of Candace's followers. So if you and your family want to come in, whoever you want to bring in, we are going to extend a 50% off your initial visit. Whether that's needing x-rays, not needing x-rays, wherever what stage you're in, we're going to offer you 50% for you and your whole family that you bring in.
Thank you so much for watching our video today. And don't forget to leave comments and subscribe below. I will leave all the contact information and hours of operation in the end of this video. And we're going to say bye-bye for now.